Hey everyone, just going over week 13. We're getting close to the end of the course. So in this video, I am going to go over the readings and the discussion for the week, as well as the paper, the week 13 assignment. So this week is focused on treatment for older adults with substance use disorders. This is something that's very much increasingly relevant nowadays because of the growing elderly population, or the growing population of older adults, as the baby boomers are getting into that phase of life. I think one of the articles even mentioned, and it was an older article too, that the population of older adults has doubled over the past few years. I think that was the 2008 article that referenced that. So it's, just likely grown over time as well. Our older adults are also dealing with substance use disorders, and it's something that is very much relevant. You'll see more and more people who are at retirement age entering rehabs. And there are some special considerations that you might want to take with their treatment related to some biopsychosocial concerns, as well as just phase of life issues. So you have 3 articles and the chapter 18 in the Strassner book this week to read. And then just take a look at the Jose case study. That's going to be a focus for your discussion this week, as well as a sample of treatment plan goals and objectives, because for your discussion, you will be creating a treatment plan. So that takes us to the discussion for the week. So you're going to take your knowledge from the readings and you're going to reference the case of Jose, which you can click here or back in learning materials. And you're going to be focusing on developing a treatment plan for him. So take into consideration some biopsychosocial concerns and culture acculturation. Just make sure that your treatment plan is appropriate to his age and to his culture as well. So we do have a treatment plan template here, but you can see essentially the sample treatment plan here is within that template. So I do want you to identify 2 different problems related to the case of Jose, and you're going to be creating goals and objectives. So that means you're going to have, for objectives for each goal, you are going to have a total of 4 objectives. So 2 objectives for each goal. So 2 problems, 2 goals, and then 2 objectives for each goal, making it 4 total objectives. So here you can see the example. I would like you, so this is a very basic example. I would like you to try to make your objectives measurable. Just in the field, that is a kind of a focus for a lot of facilities, and auditors like to see measurable goals. So for instance, an example would be anger, outbursts, and rage. The goal is prevent physical and verbal explosions. So to make this particular objective measurable, all you would need to say is identify 3 triggers for anger or rage. And then it would be for identifying strategies, you could say identify 3 or more strategies to manage anger, or 3 or more healthy coping skills to manage anger. So that is an extra step that I'd like you to take, and because that is something that's going to be very relevant to your practice. So that is part 1, just creating that treatment plan. Part 2, you're going to summarize the details and cultural considerations regarding Jose that you would take into account when carrying out your interventions. And this is where I want you to be referencing some of the readings. So you'd be looking at your treatment plan and referencing that and saying, what are some special considerations that you might have when you're carrying out these goals, whether it be related to age. So biopsychosocial considerations for an older adult might be physical health as well. Considering that, an older adult, they may have lost their ability to do some more active kinds of activities. For instance, like let's say they liked to do manual labor, but they can't do manual labor anymore. You might adjust that and say they will walk outside, or they will lift weights, or something more less intense than something that they're capable of doing at this point in their life. So those are some things that you might want to consider. There are also some cultural considerations related to Jose that you might want to consider as well. You are required to respond to at least one classmate, and you're going to present an intervention for Jose based on the treatment plan that your classmate had described, and then provide a rationale for choosing that intervention. You might put some consideration on some of those biopsychosocial factors, and why that intervention might be helpful for Jose. Moving on to the paper. So this is really a reflective paper looking at a lot of the information that we had learned so far in the course, and as well as your small group presentation. So this paper relates to your group presentation, but it is an individual paper. You do not have any requirement to communicate with your other classmate who you did the presentation with. Of course, you can discuss it if you think it might be helpful. You can always reach out to other classmates if you have questions, or just want to consult with them on something, but it's not required for you to work together on this paper. So what we're doing in this paper is I want you to explore one additional type of intervention for the population that you were focusing on for the oral presentation. And when I say one additional intervention, that means an intervention that is not listed that has not already been discussed through the presentation. So I'll clarify this. If you were in a group of 2 instead of 3, if you would like to do the intervention that was listed that was not presented on, for instance, if you had a group of 2 and nobody presented on the family intervention, you can certainly present on that, but I am asking that you don't present on that you do not write about an intervention that has already been presented on for your population. So you can also view other students assigned types of therapies or treatment modalities as long as it's not something that has already been presented on. Like I said, I'm just looking for something a little bit different. So what I mean by that is you can look at the other populations and their interventions that were discussed. But if it was already presented on, I would like you to choose something different. So some examples of interventions that you could use any kind of treatment modalities that were discussed, whether it's in this course or other courses. So examples could be narrative treatment, it could be basic CBT, it could be solution focused, it could be, we don't want to focus on 12-step because that is not technically an intervention for treatment. It is not, it's something that's used within rehabs, but it's not a theoretical intervention. So for your introduction, you're just going to discuss the intervention that you'll be using, briefly describe the population you presented on, and briefly introduce your case study. So you are going to be focusing on just one treatment model for either individual or family. You're going to address these components here. So use this, you can even use these as headers, just discussing the theoretical framework. And, we always want to be using a strengths-based perspective, and how this can be utilized within the intervention. You might discuss a little bit about how sessions are structured within the intervention, so including times. So let's give an example of CBT. Maybe you would focus on first discussing any concerns that the client has. Then you might go into, a thought record or cognitive restructuring for a period of time, and then you might go into coping skills, or you might structure it like, let's talk about triggers this session, or the next session let's focus on coping skills. So you might want to discuss like a little bit about the structure, and it can be like how you would structure a few sessions or how you would structure one session. And then you're going to be creating a treatment plan. Remember, goals and objectives. Preferably the objectives would be measurable, and you can kind of format that in the way that you did for the discussion, but make sure it is for your particular case study. Then techniques used for the intervention. So remember that theoretical framework is different than intervention. So a theoretical framework, I'm going to use the example of CBT. CBT is the theoretical framework. An intervention for CBT might be behavior activation, it might be cognitive restructuring, it might be identification of coping skills, it might be problem-solving skills. So you're going to discuss the specific techniques that you would use for the intervention within the theoretical framework. And then discuss how effectiveness can be evaluated. So this could be using different tools to measure progress, or it can be just generally checking in with your client about how they feel that the intervention has been in terms of effectiveness. And then you're going to discuss a bit about the empirical basis. So you're going to be looking for scholarly sources that discuss the effectiveness, or like it says here, lack thereof, for the specific problem and population. Make sure that you're finding some articles that are related to the specific population that you're referring to and that theoretical framework. And then discuss the application in various settings, including strengths and weaknesses. An example of this could be different levels of care. How would you apply this particular treatment modality within different levels of care? So then you're going to provide a summary of what you learned from the literature, an assessment, one of your own assessments of the intervention. So you're going to be giving your thoughts on how you feel that this would be effective. We already discussed the empirical evidence related to the intervention. On the critical assessment portion, I really want you to discuss your own thoughts. And then implications of what you learned for your own practice with addicted persons and their families. And then include references, of course. I already touched on this note here. Self-help groups like 12-step recovery groups are not considered intervention models. Again, they're seen to be very helpful, but they're not considered theoretical frameworks and should not be used for this paper. Just some guidelines here. Make sure that it's appropriate APA format, preferably 6 to 8 pages. There is a minimum of scholarly sources, so make sure you have at least 3. And this paper is due by Thursday at 11:59 p.m. If you have any questions, I just wanted to give you a brief overview here. I know in the beginning I had mentioned that you don't want to use an intervention that's already been presented on. I can clarify that there are only so many theoretical frameworks. If you do really want to use an intervention that was presented on, you can use one from a separate group that was used to describe within a different population. Just clarifying, I don't want you to use an intervention that was used within your group already or that you've already presented on. I'm asking for you to look at something different just to expand your knowledge. But it may be relevant for you if you really want to use an intervention that was presented on by another group. You can do so. Maybe check with me first and we can discuss it. It would be most ideal to discuss something that has not already been presented on, just in terms of furthering your learning. So that's all I have for this week. I hope you all have a great week and reach out with any questions.